September 2, 1945. Tokyo Bay. 20 million people were dying. Not from bullets, not from bombs, from something invisible, something that had waited patiently through 6 years of war for this exact moment of collapse. The signatures on the surrender documents were still drying when American military doctors received the intelligence reports. Typhus spreading through Osaka at exponential rates. Smallpox erupting in Kyoto's refugee camps. Cholera contaminating Tokyo's water supply. The numbers were catastrophic. Without immediate intervention, epidemiologists projected 20 million deaths within 18 months. An entire generation gone. But here's what they didn't tell you in history class. The enemy became patients. The conquerors became healers. And the most hated substance in modern history, DDT, became the tool that saved an empire from biological annihilation. This is the story of the greatest humanitarian operation in military history. The mission to vaccinate 80 million people, to spray an entire nation, to rebuild a medical system from rubble, and to do it all while the bodies were still warm from war. What happened next defied everything both sides expected. This is that story. August 15, 1945, 7:21 p.m., Yokohama Municipal Hospital. Dr. Nakamura Kenji pressed his palm against the concrete wall of the hospital's basement. Still warm. The firebombing had been 4 months ago, but the stones held heat like memory. Around him, in the dim kerosene light, 17 patients lay on straw mats. Typhus. He could diagnose it now by smell alone, that peculiar sweet rot odor of fever consuming a body from within. He had no medicine, no serum, no vaccines. The American blockade had seen to that. His hands trembled as he recorded the day's death count in a water-stained ledger, 3 more. He was down to half a pencil. When it ran out, he'd stop keeping records. What did numbers matter anymore? The Ministry of Health had collapsed. The imperial medical infrastructure, that magnificent system that had once eradicated beriberi, that had controlled tuberculosis better than any Asian nation, had been pulverized into dust alongside everything else. Nakamura was 34 years old. He looked 60. He weighed 98 pounds. Before the war, he'd weighed 145. Outside, in the rubble-choked streets, typhus moved like wildfire through human kindling. The disease had always been there, lurking in the lice, in the fleas, in the microscopic spaces between unwashed bodies pressed together in bomb shelters. But the war had created perfect conditions, millions of refugees flowing from city to city, overcrowded trains, collapsed sanitation systems, bodies buried in shallow graves, rats multiplying in the ruins. The numbers were staggering, though few knew them yet. In Tokyo alone, 30,000 confirmed typhus cases. In Osaka, 45,000. But those were just the documented ones. The actual numbers were 3, maybe 4 times higher. The disease killed slowly, methodically, with a 10–30% fatality rate. Do the math. Conservative estimates put potential deaths at 200,000 from typhus alone. And typhus was just one horseman of the apocalypse galloping through Japan's devastation. Smallpox, that ancient killer, had erupted in Kyoto's refugee centers. Without the vaccine production facilities bombed into oblivion, without the cold chain necessary to transport vaccines, without even basic sterilization equipment, the virus spread unchecked. In Nagasaki, already obliterated by atomic fire, survivors now faced pox lesions covering their radiation burns. The cruelty was almost poetic. Cholera had contaminated the water supply of 17 major cities. The sewage systems, never robust, had been shattered by bombing. Fecal matter mixed with drinking water. The bacterium Vibrio cholerae found paradise in this dysfunction. People drank. People died. The cycle accelerated. Tuberculosis, always Japan's silent mass murderer, now flourished in the perfect conditions of malnutrition and overcrowding. Before the war, TB killed 150,000 Japanese annually. Now, with immune systems compromised by starvation, with hospitals destroyed, with no streptomycin available, the death toll was projected to triple. Dr. Nakamura had been trained at Tokyo Imperial University, one of the finest medical schools in Asia. He understood epidemiology. He could calculate R0 values, could project epidemic curves, could model population collapse. His calculations, done by candlelight with his half-pencil, predicted something he barely dared write down. If current trends continued, if no intervention occurred, if the infrastructure remained destroyed, Japan would lose between 15 and 25 million people to disease within 2 years. That was more than all Japanese military and civilian casualties during the entire war. More than both atomic bombs multiplied 100-fold. It would be death on a scale that would make the war itself look like a preliminary tragedy. He had written to the new government, whatever remained of it, detailing the crisis. No response. He had appealed to remaining military medical units. They were disbanding, hiding uniforms, burning records, trying to disappear before war crimes trials began. He had contacted international relief organizations. None could access Japan yet. The surrender terms were still being negotiated. Dr. Nakamura understood with perfect clarity that he was watching a civilization die. Not from bombs, but from the microscopic aftermath. And then the Americans arrived. September 8, 1945. Atsugi Air Base, Kanagawa Prefecture. Colonel Crawford Harrison, U.S. Army Medical Corps, stepped off the C-47 transport into Japanese air that tasted of ash and salt. He was 42, a veteran of North Africa and Italy, a man who'd seen the inside of field hospitals from Anzio to the Rhine. He thought he understood devastation. He understood nothing. His briefing folder, stamped secret in red ink, contained intelligence reports compiled by Army epidemiologists, OSS operatives, and decoded Japanese medical transmissions. As his convoy of jeeps rolled toward Yokohama, Harrison read the projections a third time, looking for an error in the calculations. There was none. The paper trembled slightly in his hands, not from the road's roughness, but from the number written in the final assessment. 20,000 casualties expected without immediate intervention. 20 million. The entire population of California, Texas, and New York combined. Gone. Within 18 months. Harrison had been appointed Deputy Chief of the Public Health and Welfare Section of General MacArthur's Occupation Headquarters, GHQ SCAP, General Headquarters, Supreme Commander for the Allied Powers. His orders were unprecedented in military history: prevent the complete epidemiological collapse of a nation of 80 million people who 3 weeks ago had been trying to kill him. The irony wasn't lost on Harrison. Weeks ago, his medical units had been treating American boys wounded by Japanese bullets. Now those same units were being retasked to save Japanese civilians from invisible bullets of bacteria and virus. But here was the thing Harrison understood that most didn't. Epidemics don't respect surrender documents. Disease doesn't honor peace treaties. If Japan collapsed into pandemic chaos, it would spread to Korea, to China, to American occupation forces. The troops he'd brought with him, thousands of young Americans who'd survived the war, were now surrounded by epidemic conditions. If he failed, they'd start dying too. Not from enemy action, but from typhus-carrying lice crawling off Japanese civilians onto American uniforms. The convoy stopped at a roadblock. A Japanese policeman, hollow-cheeked, uniform hanging off his frame like fabric on a scarecrow, approached cautiously. Through an interpreter, he explained that the road ahead was quarantined. Typhus outbreak. 17 dead in the past week in the village beyond. Harrison made his first operational decision. We're going through. Get the medical team ready. The village was dying. He could see it within minutes. 60 houses, maybe 300 people. At least 50 were sick. Maybe 100 had already died. The math was crude, but the smell confirmed it. Bodies had been buried in gardens, in rice paddies, wherever there was soft earth. Lime had been scattered over the graves, but there wasn't enough lime, and the September heat was doing its work. An elderly man approached, the village doctor, though his medical bag contained only bandages and prayer beads. Through the interpreter, a grim dialogue. How many sick? Many. How many dead? Many. Do you have medicine? A long pause. Then we have prayer. Harrison had brought 12 medical officers with him on this reconnaissance. Captain Thomas Webb, an epidemiologist from Harvard, was already walking through the village, taking notes in a small black journal. When he returned to Harrison's jeep, his face was gray. Sir, every house has at least one case. Typhus, definitely. Probably also dysentery. I saw 3 kids with smallpox lesions. Unmistakable. The well water smells wrong. I'd bet money it's contaminated. No sewage system at all anymore. It's all going straight into the creek that feeds the paddies. Treatment? They don't have aspirin. They don't have clean water. They don't have soap. They have nothing. Harrison looked at his watch. 3:47 p.m. He'd been in Japan for 6 hours. The scope of the catastrophe was already clear. This village was a microcosm. There were 10,000 such villages across Japan. There were 50 cities in similar or worse condition. That night, at the commandeered hotel in Yokohama that served as temporary headquarters, Harrison composed his report to MacArthur. The language was precise, clinical, devastating. Current epidemiological assessment indicates imminent population collapse across all major Japanese urban and rural centers. Typhus cases exceed 400,000 based on conservative extrapolation from sampled regions. Smallpox outbreaks confirmed in 23 cities. Cholera contamination affects water supplies serving approximately 15 million persons. Tuberculosis rates approaching epidemic proportions. Medical infrastructure 85% destroyed. Pharmaceutical production capacity 0. Hospital bed availability below 10% of pre-war capacity. Without immediate large-scale intervention, projected mortality 15-25 million persons within 18 months. Epidemic will spread to Allied occupation forces. Recommend immediate implementation of comprehensive public health program including mass vaccination, vector control, water purification, and medical infrastructure rehabilitation. Request authority to proceed with emergency measures. Request immediate shipment of 100 million doses smallpox vaccine, 50 million doses cholera vaccine, 20 million doses typhus vaccine, 5,000 tons DDT powder, medical supplies sufficient for population of 80 million for 1 year. He signed it, sealed it, sent it, and waited for someone in command to tell him he was insane. September 15, 1945. GHQ SCAP Headquarters, Daiichi Building, Tokyo. General Douglas MacArthur read Harrison's report in silence. His Chief of Staff, Major General Richard Sutherland, stood waiting. The request was staggering. The resources Harrison was asking for would cost hundreds of millions of dollars, perhaps $1 billion. Money that Congress would have to appropriate for the purpose of saving the people who just tried to kill American boys at Iwo Jima and Okinawa. MacArthur, that complex mixture of ego and competence, of showmanship and strategic brilliance, understood something that history would take decades to fully appreciate. The occupation of Japan would be judged not by how thoroughly he could punish, but by how effectively he could rebuild. He signed the authorization in his famous flourished signature. Give Harrison whatever he needs. If we let Japan collapse into plague, we'll be fighting disease and chaos for a generation. If we save them now, we'll be heroes. Make it happen. What happened next was one of the most extraordinary logistical operations in American military history, and one of the least known. The United States military machine, which had just finished defeating 2 empires across 2 oceans, pivoted overnight from destruction to salvation. The same Liberty ships that had carried ammunition to Pacific Islands now loaded medical supplies. The same Air Force that had firebombed Tokyo now airlifted vaccines. The same army that had island-hopped through Japanese-held territory now deployed not as conquerors, but as physicians. Within 2 weeks, the first shipments arrived at Yokohama port, 50 million doses of smallpox vaccine, packed in ice, flown from production facilities in Philadelphia and Boston, 30 million doses of cholera vaccine, manufactured in Army laboratories, 15 million doses of typhus vaccine, still experimental, rushed into production 3,000 tons of DDT powder in white paper bags stamped with U.S. Army markings 500 mobile medical units, complete with portable generators, surgical equipment, sterilization facilities, 10,000 tons of medical supplies, bandages, antiseptics, surgical tools, antibiotics, antimalarials, 200 portable water purification units, 1,500 American military doctors, nurses, and medical technicians, volunteers all. The cost was astronomical by 1945 standards, over $400 million, roughly $7 billion in 2024 dollars. Congress appropriated it with surprisingly little debate. Whether motivated by humanitarian concern, strategic calculation, or the need to protect American occupation troops, the result was the same, an unprecedented commitment to save a recently defeated enemy. But resources alone weren't enough. The real challenge was implementation. October 3, 1945. Shibuya District, Tokyo. The DDT teams arrived like science fiction made real. They came in trucks marked with red crosses. They wore white protective suits, goggles, masks. They carried cylinders connected to hoses that ended in spray nozzles. Behind them, loudspeakers mounted on jeeps announced in Japanese, "Free delousing," protection from typhus. Cooperation with public health authorities is requested. At first, the Japanese civilians ran. The sight was terrifying. Strange, white-suited figures spraying unknown powder, ordering people to submit to fumigation. Rumors spread instantly. The Americans were using chemical weapons. This was delayed poison. This was revenge for the war. Dr. Nakamura, still working at Yokohama Municipal Hospital, was one of the first Japanese doctors recruited to help. The Americans needed local medical professionals to explain, to translate, to bridge the chasm of distrust. He remembered his first conversation with Colonel Harrison. "Dr. Nakamura, I need your help. We have a weapon against typhus. It's called DDT. It kills the lice that carry the disease. But your people are afraid. They have reason to be afraid of American weapons. This weapon saves lives. I need you to trust me. Then I need you to help me earn their trust." Nakamura had been skeptical. He'd read about DDT, dichlorodenphanyl-trichloroethane, in pre-war medical journals. It was a new insecticide discovered by Swiss chemist Paul Müller. The Americans had used it extensively in the Pacific Campaign to control malaria among troops. But using it on civilians? On millions of Japanese civilians? Harrison showed him the research, the toxicology reports, the successful trials. The evidence from Italy, where DDT had stopped a typhus epidemic in Naples in 1943 and 44. "How many people will die of typhus without this?" Harrison asked. Nakamura did the calculation in his head. Current infection rate, mortality rate, population density, perhaps 2 million. How many will die from DDT exposure? Nakamura examined the data. The evidence suggests very few, perhaps some skin irritation, some allergic reactions, but essentially zero compared to typhus. It was the kind of calculation doctors make, but rarely at this scale. The lesser of two evils. The trolley problem made flesh and policy. Nakamura agreed to help. The delousing program began systematically. American medical teams, accompanied by Japanese medical personnel and translators, set up stations across every city, every town, every village. The procedure was simple but strange. Civilians lined up. They removed outer clothing. DDT powder was applied directly to their bodies, down collars, into hair, along seams of clothing. Clothing was sprayed. People were sent home with instructions to not bathe for 3 days. The powder was white, fine, with a faint chemical smell. It dusted everything. It clung to hair, to fabric, to skin. Tokyo began to look like it had snowed in October. The scale was unprecedented. In the first month, 2 million Tokyo residents were deloused. By December 1945, over 8 million. By March 1946, virtually every person in major urban areas had been treated. Those in contact with confirmed typhus cases received multiple treatments. The results were undeniable. Typhus rates, which had been climbing exponentially in August and September, plateaued in October. By November, they were falling. By January 1946, they had dropped by 80%. By summer 1946, typhus had been effectively eliminated as an epidemic threat in Japan. The disease that had killed hundreds of thousands in Europe during the war, that had ravaged Russia, that had destroyed armies and devastated populations throughout history, stopped. Not by medicine treating the sick, but by killing the vectors that spread it. DDT had worked. But here's the historical irony that makes this story so complex. In 1945, DDT was a miracle. Today, it's a symbol of environmental catastrophe. Rachel Carson's Silent Spring 1962 would expose how DDT accumulates in ecosystems, poisons wildlife, causes eggshell thinning in birds, potentially affects human health. DDT would be banned in the United States in 1972, vilified as an ecological disaster. But in 1945? In October 1945, when Dr. Nakamura watched American soldiers dust white powder onto Japanese children, and those children stopped dying of typhus, DDT was salvation. The moral complexity of this moment deserves pause. The same substance that saved millions in the 1940s would harm millions in different ways in later decades. There's no clean resolution to this paradox. The Americans didn't know about the environmental consequences. The science didn't exist yet. They only knew that people were dying and DDT stopped the dying. History is rarely kind enough to offer pure heroes or pure villains. Only choices in the moment with the knowledge available and consequences that echo forward in ways no one can predict. November 1945. Yokohama Vaccination Center. While DDT handled typhus, the other epidemics required different weapons, vaccines. The American military had brought enough smallpox vaccine to immunize 50 million people. Cholera vaccine for 30 million. Typhus vaccine for 15 million. But vaccines are useless in warehouses. They require delivery systems, cold storage, trained administrators, and above all, trust. The vaccination campaign that unfolded across Japan in late 1945 and early 1946 remains one of the largest mass immunization programs ever attempted. Consider the logistics. 80 million people needed to be reached. Many locations required multiple doses. Smallpox needed 1, cholera needed 2, typhus needed 3. Vaccines required refrigeration in a country where electricity was sporadic. Records needed to be kept to prevent over or underdosing, all of this in a destroyed infrastructure. With a traumatized population in a recently hostile country, the Americans established 2,500 vaccination centers across Japan. Each center was staffed by a team. 1 American medical officer, 2 American nurses or medics, and 4 Japanese medical professionals, doctors, nurses, or trained technicians. The centers operated like assembly lines. People lined up, sometimes hundreds, sometimes thousands. Forms were filled out, name, age, address, previous vaccinations. Arms were swabbed with alcohol. Needles were inserted. Adhesive bandages applied. Records were stamped. Hour after hour, day after day. Week after week. In Yokohama alone, 1.2 million people were vaccinated in the first 3 months. In Tokyo, 4.5 million. Across the entire country by spring 1946, over 60 million vaccinations had been administered. But numbers alone don't capture the human drama. Imagine being a Japanese civilian in November 1945. Your country has been defeated. Your cities are rubble. American soldiers, the enemy who firebombed your home, who killed your relatives, are now running medical centers, asking you to roll up your sleeve, to accept a needle, to trust that they're trying to help rather than harm. The initial resistance was intense. Rumors spread that the vaccines were poison, that this was delayed revenge, that the Americans were conducting medical experiments like the Japanese had done in Manchuria. Unit 731's atrocities were beginning to leak into public consciousness. The breakthrough came through demonstration and results. In Nagoya, a smallpox outbreak erupted in a refugee camp. 200 cases in 2 weeks. An American medical team led by Major Patricia Walsh, one of the few female medical officers in the occupation force, set up a vaccination cordon around the camp. Everyone within a 5-mile radius was vaccinated. The outbreak stopped within a month. Zero spread beyond the cordon. Word spread, not through propaganda, but through the oldest form of communication. People who had been vaccinated didn't get sick. By January 1946, the lines at vaccination centers had changed. People no longer came reluctantly. They came urgently. Mothers brought children. The elderly made long journeys from rural areas. Former soldiers, still wearing pieces of their uniforms, stood in line next to the American soldiers who'd fought against them. Dr. Nakamura worked at one such center. He later wrote in his journal, portions of which were translated and archived by the Occupation Administration. There is something surreal about giving injections alongside American medics. 6 months ago, I treated Japanese soldiers wounded by American bullets. Now I watch American hands gently steady Japanese arms for vaccination. The colonel who supervises our center, Harrison, works 16-hour days. He looks exhausted. I asked him why he works so hard for people who were recently his enemies. He said, "Disease is the real enemy, doctor. We're just soldiers in a different war now." I'm not certain I trust this sentiment entirely. But I trust the vaccines, and I trust what I see. People who are vaccinated don't die. That's medicine. That transcends politics. The smallpox campaign was particularly successful. Smallpox is a peculiar disease, highly visible. The pox lesions are unmistakable, highly contagious, highly deadly, 30% mortality rate, but also preventable with a highly effective vaccine. The before and after statistics are stark. August-September 1945, 15,000 confirmed smallpox cases, estimated 4,500 deaths. October-December 1945, mass vaccination begins. 25 million people immunized January-March 1946. Smallpox cases dropped to 3,000 April-June 1946. Smallpox cases dropped to 400 by 1947. Smallpox effectively eliminated from Japan. It was a preview of what would happen globally decades later when the WHO launched its smallpox eradication campaign. Japan, devastated and occupied, became an accidental test case for mass vaccination's power. The infrastructure resurrection, January 1946. Tokyo Medical College, formerly destroyed, now rebuilding. But vaccines and DDT weren't enough. The Americans understood something crucial. Temporary intervention would produce temporary results. For Japan to survive long-term, its medical infrastructure needed resurrection. Colonel Harrison convened a meeting with Japanese medical administrators, educators, and surviving hospital directors. The American position was clear. We'll provide resources, expertise, and supplies, but you must rebuild your own system. We won't be here forever. You need to be able to sustain this. The rehabilitation program was comprehensive. Medical education reform. Tokyo Medical College reopened with American advisors. Curriculum revised to include modern public health, epidemiology, preventive medicine. 500 Japanese medical students received scholarships to study at American medical schools. American medical textbooks were translated into Japanese standards of medical practice, were updated to match Western protocols. Hospital reconstruction. 150 hospitals were rebuilt or significantly repaired with American materials and Japanese labor. Modern sterilization equipment installed, operating theaters equipped with American surgical tools, laboratory facilities established for diagnostic testing, cold storage units for vaccine preservation, public health infrastructure, a national disease reporting system was established. Every case of infectious disease had to be reported to central authorities. Sanitation standards were codified and enforced. Water purification systems were installed in 30 major cities. Sewage treatment facilities were built or restored. A national vaccination schedule was created, similar to America's. American pharmaceutical companies partnered with Japanese firms. Vaccine production facilities were built in Osaka, Tokyo, and Kobe. By 1948, Japan was producing its own smallpox vaccine, cholera vaccine, and basic antibiotics. Quality control systems were implemented. The cost of this infrastructure work was staggering, over $200 million beyond the immediate medical supplies. But it was infrastructure with a multiplier effect. Every hospital rebuilt could treat thousands. Every doctor trained could save hundreds. Every vaccine production facility could protect millions. One example illustrates the approach. Osaka Central Hospital had been 70% destroyed by firebombing. American engineers surveyed the damage and proposed rebuilding. But instead of imposing an American design, they collaborated with Japanese architects to create a hybrid, structurally sound by American engineering standards, but aesthetically and functionally Japanese in layout and practice. The hospital reopened in March 1946. It had 500 beds, modern surgical facilities, an X-ray machine, rare in Japan then, and a laboratory capable of diagnosing infectious diseases. By year's end, it had treated 18,000 patients. By 1948, it was training its own medical staff. Multiply that by 150 hospitals. The scale becomes clear. June 1946, GHQ SCAP medical report. By mid-1946, 9 months into the occupation's medical program, the data was undeniable. Harrison compiled the statistics for MacArthur's Review. Typhus, August 1945, 400,000 estimated cases climbing exponentially. June 1946, 8,000 cases declining rapidly. Reduction 98% lives saved. Estimated 1.5 to 2 million based on 10 to 30% mortality rate. Smallpox, August 1945, 15,000 cases, multiple outbreaks, June 1946, 200 cases, isolated incidents, reduction 98.7% lives saved, estimated 300,000, 500,000, based on 30% mortality rate and epidemic spread potential. Cholera, August 1945, water supplies of 15 million people contaminated. June 1946, major water supplies sanitized, vaccination coverage, 85% active cases reduced from 50,000 to 500 lives saved, estimated 200,000, 400,000 tuberculosis. More complex, TB is a slow killer mass screening implemented. 12 million people tested, treatment facilities established, death rate stabilized, then began declining, lives saved over next decade. Estimated 500,000, 1 million. By conservative estimates, the American medical intervention prevented 15 to 20 million deaths over the 18-month period following Japan's surrender. The upper estimates reached 25 million, nearly one-third of Japan's population. To put this in perspective, the United States military, which had killed approximately 500,000, 900,000 Japanese during the war, including atomic bomb casualties and firebombing, had now saved 20 to 25 times that number from disease. The irony was profound, the symmetry almost poetic. April 1947. Ueno Park, Tokyo. Doctor. Nakamura stood in Ueno Park on a spring morning, watching cherry blossoms fall like pink snow. The trees had bloomed through the war, through the bombing, through the occupation. They bloomed indifferently, beautifully, regardless of human catastrophe or redemption. He was attending a ceremony, a memorial for those who had died in the epidemics of 1945. A stone monument had been erected, inscribed with thousands of names. Among them, 17 patients from his hospital, colleagues, friends, people he'd been unable to save. Colonel Harrison stood beside him. The American looked older now. The stress of the past 18 months had carved lines into his face. But he looked satisfied. The medical crisis had been resolved. The occupation's health directive was being handed over to Japanese administrators. The Americans were beginning to withdraw from day-to-day operations. Through an interpreter, Nakamura said, "You saved my country." Harrison shook his head. "We gave you medicine. You saved yourselves by accepting it." It was a diplomatic answer, but also partially true. The success of the medical campaign had required Japanese cooperation at every level, from administrators to doctors to civilians rolling up their sleeves. Without that cooperation, all the DDT and vaccines in the world would have been useless. But Nakamura pressed the point. You could have let us die. Many Americans would have preferred that. Harrison was quiet for a moment, watching the blossoms fall. Then, "I'm a doctor. I don't get to choose which patients to save based on whether I like them. Disease is the enemy." That's all I know. It was the same answer he'd given before. But this time, Nakamura believed it completely. Later that day, Nakamura wrote in his journal, "The Americans are preparing to leave the medical administration to us. We are ready. They taught us well, not just medicine, but systems, standards, protocols. They gave us not just vaccines, but vaccine factories. Not just treatment, but training. I wonder if they understand what they've done. They defeated us in war, then saved us in peace." This is more confusing than simple conquest would have been. How do you hate someone who vaccinated your children? How do you resent someone who stopped the epidemic that would have killed your parents? The war created 20 million potential deaths. The peace prevented them. Both were American actions. I don't know how to hold these contradictions in my mind, but I know this: I'm alive. My patients are alive. Japan is alive. That is enough. 1950, 1960. The legacy unfolds. The medical intervention of 1945, 1947 had effects that rippled forward for decades. Japan's post-war economic miracle is usually attributed to industrial policy, American aid, cultural factors, and Japanese ingenuity. All true. But here's what's often overlooked. You can't have an economic miracle without a living population. You can't rebuild industries without healthy workers. You can't create the Honda, Sony, and Toyota if half your workforce is dead from typhus. The 20 million people who didn't die from epidemic disease went on to become the workers who rebuilt Japan's industries, the entrepreneurs who founded new companies, the engineers who created technological innovations, the teachers who educated the next generation, the parents who raised the baby boom generation that drove the 1960s-70s economic expansion demography is destiny, and the Americans had preserved Japan's demographic foundation. Moreover, the medical infrastructure built during the occupation became the basis for Japan's world-class healthcare system. By the 1960s, Japan had one of the highest life expectancies in the world, one of the lowest infant mortality rates, a comprehensive national health insurance system implemented in 1961, advanced medical research facilities, pharmaceutical industry producing cutting-edge medications. None of this would have been possible if the 1945-46 epidemics had been allowed to run their course. There's also a darker echo worth examining, the DDT program. That white powder that saved millions in the 1940s was still being used extensively in Japan through the 1950s and 60s for agriculture, for mosquito control, for general pest management. When the environmental costs became clear in the 1970s, Japan had to grapple with contamination issues, ecological damage, and health concerns from decades of DDT use. The miracle weapon had consequences. Nothing is free. Every solution carries hidden costs. 2025, the historical memory. Here's the strange thing about this story. Almost nobody knows it. Ask Americans about the occupation of Japan, and they'll mention Hiroshima, MacArthur, democracy building, maybe the war crimes trials. Very few will know about the vaccination campaigns. The DDT program barely registers. The fact that American military doctors saved an estimated 20 million Japanese lives from epidemic disease. Forgotten. Ask younger Japanese and you'll get similar gaps. The post-war period focuses on economic recovery, constitutional reform, the peace constitution, American cultural influence. The medical intervention, a footnote if mentioned at all. Why? Partially because it's complicated. It doesn't fit clean narratives. The Americans were both destroyers and saviors. DDT was both miracle and poison. The occupation was both humiliating and helpful. It's messy. History prefers clean stories. Partially because disease prevention is invisible. When you successfully vaccinate millions, nothing happens. No dramatic images. No single climactic moment. Just people who quietly don't get sick, don't die, don't make headlines. Prevention is the most important public health achievement and the least cinematically interesting. Partially because by the time historians started seriously analyzing the occupation, the medical crisis had been so thoroughly resolved that it seemed inevitable. Success erases its own drama. But the numbers remain. 80 million doses of vaccines, administered 3,000 tons of DDT, deployed 150 hospitals, rebuilt 2,500 medical centers, established 500 Japanese doctors, trained in American medical schools, 15 to 25 million deaths prevented. This was humanitarian action on an unprecedented scale. It was also strategic calculation, preventing epidemic spread, protecting occupation troops, stabilizing a key Cold War ally. It was both idealistic and pragmatic, generous and self-interested, admirable and insufficient. It was, in other words, perfectly human. The questions that remain. Should the Americans get credit for saving lives after creating the conditions that necessitated saving? They bombed the cities, destroyed the infrastructure, created the refugee crisis that spread disease. Then they provided the medicine. Is that redemption or just damage control? Dr. Nakamura in his later years was asked this question repeatedly. His answer evolved over time. In 1950, they broke us, then fixed us. Both are true. In 1970, without them we would have died twice, once from war, once from disease. They only prevented one death, but one is better than two. In 1985, shortly before his own death, I've stopped trying to balance the moral ledger. I'm alive. That's not nothing. The mathematics of morality don't balance cleanly. But here are some facts. The atomic bombs killed approximately 200,000 to 250,000 people immediately and in the months following. The firebombing campaigns killed another 300,000, 400,000. Total Japanese war deaths approximately 2.5 to 3.1 million. The epidemics that were prevented by American intervention would have killed 15 to 25 million. Does saving more than you killed equal redemption? Does preventing future deaths balance past deaths? Is there even a calculus that makes sense here? These aren't rhetorical questions. They're the questions that haunted Colonel Harrison for the rest of his life. He returned to the United States in 1948, received commendations, was promoted to brigadier general, had a successful career in military medicine. But in his private papers, donated to the National Archives after his death in 1983, there are journals that reveal a man wrestling with moral complexity. One entry, dated March 1963. I received a letter today from Dr. Nakamura. He's now Director of Public Health for Tokyo Prefecture. He thanked me again for the work we did, said his grandchildren are healthy because of the vaccines we brought. I don't know how to respond. I think of the Japanese civilians burned in the firebombing. I think of the Americans who died at Pearl Harbor, Bataan, Okinawa. I think of the diseases we stopped. I think of the DDT that's now in the soil. Everything we did was necessary. Everything we did had costs. There are no clean victories. Only choices in the moment with imperfect knowledge, trying to do the least harm possible. This is perhaps the most honest assessment possible. 2020-2021, COVID-19 pandemic. When COVID-19 swept the world in 2020, some historians of the occupation noticed parallels. A public health crisis requiring massive logistics, vaccine development and distribution at unprecedented scale. The challenge of building trust in medical interventions, the tension between individual liberty and collective safety, the question of who deserves access to life-saving treatment. Japan notably handled the pandemic better than most developed nations. Lower death rates, higher mask compliance, more trust in public health authorities. Some analysts attributed this to cultural factors. But buried in the explanation is the legacy of 1945 to 47, a medical infrastructure built by Americans and Japanese together, a public health system that became a model, a cultural memory, even if unspoken, of the time when vaccines prevented catastrophe. The children vaccinated in 1946 became the grandparents of 2020. The hospitals rebuilt in 1946 were still operating in 2020. The disease reporting systems established in 1946 were updated but still functional in 2020. History doesn't repeat, but it rhymes. The questions remain constant. How do you convince people to accept medical interventions? How do you distribute resources equitably? How do you balance short-term solutions against long-term consequences? How do you rebuild after catastrophe? The answers from 1945 aren't perfect blueprints, but they're data points. They're evidence that mass vaccination works. That logistics matter. That trust is earned, not demanded. That infrastructure investment pays long-term dividends. That prevention is cheaper than treatment. That disease doesn't care about politics or nationality. These are lessons worth remembering. May 1947, Yokohama Municipal Hospital. Dr. Nakamura stood in his office, newly rebuilt with actual walls and windows and electricity that worked most of the time. On his desk sat a photograph he'd kept throughout the war, his medical school graduating class from 1936. 28 young men in white coats, confident and serious. He'd recently learned the fates of his classmates. 7 killed in the war as military doctors. 4 died in the atomic bombings. They'd been in Hiroshima treating wounded. 3 died in the epidemics of 1945. Typhus, cholera, typhus again. 5 emigrated, 1 to Brazil, 2 to America, 2 to Australia. 9 still practicing in Japan, like him, 14 dead. 14 alive, exactly half. But here was the thing. In August 1945, he'd expected all the survivors to die in the epidemics. Every projection said so. Every calculation pointed to total collapse. He'd prepared himself for a Japan where virtually every family lost members, where the death toll would make the war look like a prelude. It hadn't happened. 20 million deaths that didn't occur, an apocalypse prevented, a future that remained possible instead of being erased. He heard footsteps in the corridor, nurses preparing for the afternoon shift. The hospital was busy now, treating normal ailments, broken bones, pneumonia, difficult births, appendicitis. The mundane work of medicine. No more mass death. No more epidemic terror. Just ordinary suffering that could be ordinarily treated. Outside his window, Yokohama was rebuilding. Cranes lifted steel beams. Trucks hauled materials. Workers swarmed construction sites. The city was rising from ash. The country was recovering from catastrophe. It was possible because people were alive to do the work. It was possible because American soldiers had carried vaccines instead of only bullets. It was possible because enemies became patients, because conquerors became healers, because someone decided that saving lives mattered more than settling scores. Dr. Nakamura picked up his medical bag, A new one provided by the American medical supply system, sturdy canvas with brass clasps. He had rounds to make, patients to see, lives to save one at a time in the ordinary miracle of medicine. He walked out into the afternoon sun, into a Japan that was alive, into a future that had been snatched back from the edge of biological annihilation. Behind him, the photograph of his classmates watched silently. 14 dead, 14 alive. An even split. A coin toss. A reminder that survival is never guaranteed, that catastrophe always threatens, that intervention matters. The Americans had intervened. That was the fact. The rest, the moral calculus, the historical judgment, the balance of destruction and salvation, that was for others to decide, for history to weigh, for time to reveal. For now there were patients waiting. For now that was enough.